We're just completing a 5-year project that was funded by the National Health and Medical Research Council and working in partnership with 2 Aboriginal Community Controlled Organisations here in Cairns and Yarrabah. So one was a youth organisation called DIYDG, and the other one was a primary healthcare organisation called Gurriny Yealamucka Health Service. And the purpose of the project was to look at systems that support First Nations children's and youth wellbeing. So we started out looking more narrowly at mental health, and then we were advised by our project management group that we should broaden that out and look at the whole spectrum of wellbeing, right from being well, healthy and so on, all the way through to having mental illness. And also, we looked at the sort of systems right from sort of individual children's and youth wellbeing right through to sort of service providers or families, service providers, communities, and the sort of the service system that supports First Nations children and youth. We worked very closely with the community partners and the whole project was really very community driven. So there's a lot of evidence, I guess, in the literature about the fragmentation of mental health systems, and what we were looking at was how Indigenous communities made suggestions for improving the integration of service systems. Individual children and youth who needed care could get, like sort of integrated and wraparound care, and those who were well could be supported in wellness. Initially we talked to young people and service providers. Young people told us that they were reluctant to seek services, and service providers acknowledged that there were problems in service delivery and said that they felt that there was an appetite for change, that they wanted to be involved in the change process. So we also mapped service systems and we found that most of the services that were being provided were at the crisis end, supporting kids who were in out-of-home care, those with mental illnesses, those in the youth justice system, for example. Whereas there was actually only about a third of services were being provided to actually support wellness, and our service providers said a lot of our kids are falling through the system because there's nothing to support wellness at the upstream end. I think that in this kind of space, change is incremental, so there have been changes that have already occurred through the project. We used a very participatory and community-driven approach, and along the way there have been changes. For example, we, with DIYDG, one of our key partners, we supported them to sort of more clearly define and articulate their model of care. There's been some capacity development of research staff within their organisation. They now have a research sort of team actually within their organisation. We supported them to do some capability training in research, for example. And so, that organisation through the 5 years of the project has grown from a, very small sort of voluntary organisation with maybe, about 4 or 5 staff, to now being a fairly substantial organisation with, funding from multiple sources and so on. And with Gurriny, the CEO of Gurriny allowed all of their frontline staff, which was more than 70 staff, to attend a training session over 2 days in culturally responsive trauma-informed care. It's been a very productive partnership, I would say, with both organisations, and it actually has led now on to further research in the space, because I think all of these issues, they're tricky issues. You could say that they're wicked problems, and they don't go away, with simple solutions. That they require long-term effort and ongoing sort of partnerships, and really research is there to value add to what's already happening in the community.